Good morning everyone. Slide discussion. Case number 2. History given to us was female with nasal congestion, nasal obstruction and nasal discharge. This was the microscopic image. In this image, we can see prominent downward endophytic growth of round to elongated epithelial nest with smooth outer counter. Underneath, stroma is showing edema, congested blood vessels. So, the diagnosis was inverted sinonasal papilloma. Coming to review of literature, the ectodermally derived lining of sinonasal tract, which is termed as Schneiderian membrane, may give rise to 3 morphological distinct benign papillomas, collectively referred as sinonasal type of papillomas. The 3 morphological types are inverted, oncocytic and fungiform. Fungiform is also called as exophytic and septal papillomas. Collectively, these papillomas represent fewer than 5% of all sinonasal tract tumors. They have tendency to spread along the mucosa into adjacent areas. Symptoms vary according to the site of occurrence, which include airway obstruction, epistaxis, asymptomatic mass and pain. These papillomas are papillary exophytic varicoid lesions with a pink to tan appearance and a firm to rubbery consistency on gross. They are often attached to the mucosa by a narrow or broad based stalk. This is the image showing various morphological types of papillomas. Inverted papilloma is the most common type. Septal papillomas are located in the nasal septum, whereas inverted and oncocytic papillomas are located in the lateral nasal wall. All these papillomas are unilateral in nature. On histology, septal papilloma shows papillary fronds composed of predominantly squamous epithelium, mucocytes and intraepithelial mucous cyst. Inverted papilloma shows endophytic or inverted growth consisting of thicker squamous epithelium composed of squamous transitional and columnar cells admixed with mucocytes, whereas oncocytic papilloma shows multilayered epithelium proliferation composed of columnar cells with abundant eosinophilic and granular cytoplasm. Incidence of human papilloma virus, it is approximately 50% in septal papilloma, whereas it is 38% in inverted papilloma. It is typically absent in oncocytic papilloma. Incidence of malignant transformation, it is rare in septal papillomas, whereas it is 2 to 27% in inverted as well as 4 to 17% in oncocytic papilloma. This is the image showing exophytic type of papilloma. In this image, we can see the tumor has an exophytic and papillary growth protruding from the surface respiratory epithelium, and it is composed of thickened non-keratinized squamous epithelium. At higher magnification, the epithelium is bland with uniform cells, retention of cellular polarity, absence of cytological atypia, presence of scattered mucoses and intraepithelial inflammatory cells. This is the image showing inverted type of papilloma. In this inverted type, the squamous epithelial cell proliferation grows in downward direction into underlying edematous stroma. At higher magnification, the epithelial component is bland with uniform appearing nuclei and retention of polarity, scattered mucocytes and intraepithelial inflammatory cells and small cyst. This is the image showing oncocytic type of papilloma. This image shows exophytic epithelial proliferation with readily apparent eosinophilic appearance. At higher magnification, the epithelium is multilayered composed of columnar cells with abundant eosinophilic and granular cytoplasm. Intraepithelial mucin cysts and some with polymorphonuclear leukocytes are also present. Coming to differential diagnosis, sinonasal squamous cell carcinoma non-keratinizing type. This tumor invades into the submucosa as broad interconnecting bands of the neoplastic epithelium growing down into the stroma. There is marked cellular pleomorphism with loss of polarity, increased nucleus to cytoplasm ratio and increased mitotic activity. Non-intestinal type sinonasal adenocarcinoma, it has oncocytic cytomorphological features and it is characterized by complex confluent back-to-back glandular proliferation. Sinonasal inflammatory polyp, it is characterized by edematous, fibrotic or loosely arranged myxoid stroma infiltrated with mixed inflammatory infiltrates including lymphocytes, plasma cells, eosinophils and neutrophils. Thank you.